My name is Pedro. I work for Global Health Medicines R&D, GSK, and I'm here to present my poster that is focused on mouse models of Salmonella relapse infections in mice. And we are interested in working on invasive Salmonella infections because they represent a public health problem worldwide, especially thinking about resistance and persistence. Persistence that can be a source for relapse in patients. So we wanted to develop a model so that we can test interventions for this problem. Our model is very simple actually. We infect mice orally with Salmonella typhimurium, and then we treat with a standard of care, ciprofloxacin 120 mg per kilo, 2 times a day for days 1 to 3 post-infection. And then we stop treatment. At this point, mice, they seem clear of infection, they don't have symptoms, and then we observe for a relapse. And relapse may occur between days 8 and 12, 14 post-infection. As endpoints, we use survival, that is not defined as mortality, it's defined as mice reaching human endpoints for sacrifice, and CFUs in the organs that we collect from mice, spleen or mesenteric lymph nodes. So let's go into the data. So first you can see here in the graph that the infected group, control, they lose weight. So you have this acute weight loss in those mice and also have robust levels of CFUs in the spleen. The treatment with ciprofloxacin really prevents weight loss and gets to below limits of detection of the CFUs in the spleen. Interestingly, if you go to lower doses of ciprofloxacin, as you can see here in this graph, you can see that lower doses of 10 mg per kilo gets to robust levels in the spleen, also in the mesenteric lymph nodes. The 6 mg kilo doses clears levels of CFUs in the spleen, but allows detection in the mesenteric lymph nodes. This reinforces the fact that the Salmonella is really persistent because mesenteric lymph nodes are considered as a major source of persistent Salmonella in this model. And then, what about relapse? So we stop the treatment at day 3, and then as you can see here in this graph, mice, when we start treatment at day 7 or day 8, they start dropping the body weight trajectory. And this, of course, they get to human endpoints of sacrifice, then you have to euthanize them. Here on the right side, you can see the survival graph, and you can see mice, they drop, and then the lower doses of cipro, the 6 mg kilos, the purple doses, the mice drop earlier, which means that as we decrease the doses of ciprofloxacin, we have early relapse. And here on the bottom, we have the CFUs data of relapse. In the early phase, you have day 8 post-infection. We have robust levels, actually. Those mice, not all of them are sick. And when you get to really the point when mice are really sick and you have to euthanize them, and then this can get to day 14 or 21 post-infection, then we have higher levels of Salmonella. And then we had a model of like a Salmonella relapse when we treat with standard of care, and then we stop treatment. We see relapse after some days, but we needed to test the intervention or 2 compound so that we could treat this infection in those mice. So we had a compound that we tested. As you can see here, we tested several different doses. This is data combined for 2 different experiments. And this is the survival graph. You can see that as we increase the doses of the 2 compound, we have more delay of relapse. So this really reinforces the fact that this model is good for testing interventions because we are able to delay this relapse, and even like the highest doses we get just like 7 days of delay. So that's it. In conclusion, our findings show that our model could be useful for testing interventions for Salmonella relapse, and we're looking forward to further develop our model and test those compounds. Thank you.